Good day, everyone. This is Abigail Sode, and today I am going to talk about renal cell cancer. Renal cell cancer, or also called as renal cell carcinoma, is a disease in which malignant or cancer cells are found in the lining of the tubules in the kidney. Risk factors for this disease are gender. It affects men more than women. Tobacco use. Occupational exposure to industrial chemicals such as petroleum products, heavy metals, and asbestos. Obesity, unopposed estrogen therapy, and polycystic kidney disease. The tissue of origin for renal cell carcinoma is the proximal renal tubular epithelium. Renal cancer occurs in a sporadic or non-hereditary and a hereditary form, and both forms are associated with structural alterations of the short arm of chromosome 3. Genetic studies of the families at high risk for developing renal cancer led to the cloning of genes whose alteration results in tumor formation. These genes are either tumor suppressors or oncogenes. Multiple hereditary syndromes associated with renal cell carcinoma are recognized as follows: A. Von Hippel-Lindau syndrome. B. Hereditary papillary renal carcinoma. C. Familial renal oncocytoma associated with Birt-Hogg tube syndrome. D. Succinate dehydrogenase deficient RCC. And E. Hereditary renal carcinoma. After someone is diagnosed with kidney cancer, doctors will try to figure out whether it has spread and if so, how far. And this process is called staging. The stage of a cancer describes how much cancer is in the body. It helps determine how serious the cancer is and how best to treat it. The stages of renal cell cancer range from 1 through 4. As a rule, the lower the number, the less the cancer has spread. A higher number, such as stage 4, means cancer has spread more. Although each person's cancer experience is unique, cancers with similar stages tend to have a similar outlook and are often treated in much the same way. In stage 1, the tumor can be up to 2.75 inches or 7 centimeters in diameter. The tumor is confined to the kidney. In stage 2, the kidney cancer is larger than stage 1 tumor, but it's still confined to the kidney. At stage 3, the tumor extends beyond the kidneys to the surrounding tissue and may also have spread to a nearby lymph node. And in stage 4, the cancer spreads outside the kidney to multiple lymph nodes or to distant parts of the body, such as the bones, liver, or lungs. What are the clinical manifestations of renal cell cancer? Many renal tumors produce no symptoms. However, commonly, there could be weight loss, fever, and night sweats from systemic effects of renal cancer. There would also be the classic triad, which is the late symptoms that occurs in only 7% to 10% of the patients. The classic triad is composed of hematuria, which could be intermittent or continuous, microscopic or gross. Flank pain. This could be from distension of renal capsule or the invasion of surrounding structures. And C. The palpable mass and flank or abdomen. There would also be hematuria, dyspnea, cough, and bone pain with advanced disease. The complications of renal cell cancer would be the metastasis to the lung, bone, liver, brain, and other areas. What is used for the diagnostic evaluation of renal cell cancer? First is ultrasonography, which is helpful in differentiating renal cyst from renal tumor. CT scan could also be used. This is the primary technique for detecting, diagnosing, categorizing, and staging a renal mass. Intravenous pyelogram is used as a screening procedure. IVP alone may fail to detect some renal tumors. And the magnetic resonance imaging, which determines if thrombosis is in renal vein and evaluates for vascular extension. The management for renal cell cancer are as follows. Radical nephrectomy. This is the removal of kidney and associated tumor, adrenal gland, surrounding perirenal fat, gyroscopic fascia, and possibly regional lymph nodes, which provides maximum opportunity for disease control. Next is renal artery embolization. Preoperative occlusion of renal artery followed by nephrectomy. This is limited to patients with large vascular tumor in which the renal artery may be difficult to reach early in procedure. Next is cryoablation. This is the freezing of tumor with liquid nitrogen or argon gas through percutaneous needles placed into tumors, that is using ultrasound guidance. This is appropriate for tumors that are 3.5 centimeters or less in size. Chemotherapy and immunotherapy are also used for the management of renal cell cancer. Renal cell carcinomas are generally refractory to chemotherapeutic agents, radiation, and hormonal manipulation. So what is used for this management? The interleukin-2, which is a lymphokine that stimulates growth of T lymphocytes. This may offer some benefit to patients with metastatic renal cancer, although toxicity is severe. Sunitinib and sorafenib could also be used. This inhibit vascular endothelial growth factor and platelet-derived growth factors. Thermal ablation is also used to manage this disease. Thermal ablation is the use of heat through percutaneous needles to cause tissue necrosis, thus killing tumor cells. This type of management is appropriate for tumors that are 3.5 centimeters or less in size. Next is the possible nursing diagnosis and nursing interventions for renal cell cancer. First is acute pain and hyperthermia related to postinfarction syndrome. The nursing interventions could be administering analgesics as prescribed to control flank and abdominal pain. Next is encouraging rest and assist with positioning for 2 to 3 days until syndrome subsides. Obtaining temperature every 4 hours and administer antipyretics as indicated is also done. There would also be the restriction of oral intake and provide IV fluids while patient is nauseated. And lastly, administer antiemetics as ordered. Anxiety related to diagnosis of cancer and possibility of metastatic disease. In this diagnosis, the interventions would be explaining each diagnostic test, its purpose, and possible adverse reactions to the patient. Ensure that informed consent has been obtained as indicated. assess patients' understanding about diagnosis and treatment options, and answer questions and encourage more thorough discussion with healthcare provider as needed. Encourage patients to discuss fears and feelings. Also involve family and significant others in this teaching. For the prognosis of renal cell cancer, the American Cancer Society suggests that the prognosis is good for patients diagnosed with stage 1 or stage 2 renal cell cancer, which is 81% and 74% respective 5-year survival rates. The prognosis worsens as stage 3 and stage 4 develop. Renal cell cancer treated early can result in a relatively normal lifespan. However, the lifespan decreases in later stages. Thank you for listening until the end of the lesson. This is all about renal cell cancer, and I hope you've learned a lot from this lesson.